Find out what's going on. Get involved. Change things from the inside. Make a difference. Take pride. Multicultural at its best. The Luisa Marshall Show. Coming up.
Today, all news simply the best. Get involved. Canadians fighting COVID-19. On the show, Don Davies. Don is the longest-serving member of Parliament for Vancouver-Kingsway. He also serves Parliament as the NDP critic for health and deputy clinic for public safety and emergency preparedness. Don introduced more legislation in the House of Commons than any MP in the country, such as plans for a national school nutrition program, free post-secondary tuition for students with special needs, to name a few. Today, in light of the pandemic circumstances, Don is calling for more resources and funding to address mental health issues.
Into mental health.
He is also advocating for a public health care system to cover everyone's medicine during this crisis. And not to forget Don's heartwarming musical performance to thank our frontliners for their dedication and sacrifices in the battle against COVID-19. All these coming up. Hello everyone. Hope all of you are safe and healthy. Vancouver-Kingsway MP Don Davies joins us on the show, addressing the importance of funding mental health issues and free medicine during the COVID-19 crisis. Hello, Honorable MP Don Davies.
Hi, Luisa. It's wonderful to be with you virtually.
Oh, it's nice to see you. We are socially distancing right now. We are practicing it, right, Don? I would like to congratulate you for once again making history as the longest serving MP for Vancouver-Kingsway.
Thank you. Such a privilege and an honor, Luisa, to represent people of Vancouver-Kingsway, and really, I chalk it up just to staying really closely in touch with the people in our riding and trying to stay humble and serve our people in an honest and hardworking way. And I've been lucky enough to earn the trust of the people of Kingsway 4 times, and it's just a real blessing.
It is an honor to have you back, first of all. Real an honor, especially during this difficult and the most probably challenging time that we've ever faced on Earth. This is kind of overwhelming. You posted about mental health. You said that it's underfunded at the best of times, and with COVID-19, Canadians will experience added health concerns. This is your own post, okay? Job loss, financial problems, social isolation, and more that will increase mental health challenges. And you are calling for more resources and funding to address this. So what are the plans in place for people who are suffering from mental health during this time? And if we are thinking of the bigger picture, a lot of people are mentally stressed right now.
Well, first of all, thanks, Luisa, for the work you're doing in the media. I think it's so important when so many of us are having to isolate, that we have people like you and others who are connecting us together, albeit virtually. So I want to thank you for all the work you're doing in helping to keep us connecting on a human level. You raised, I think, an excellent question. I think that mental health has long been treated as almost the poor second cousin of health. You know, we've got a fairly good system for our physical health, but we forget that our brains and our emotions and our psychological orientation is as much a part of overall health as anything else is. And it's true that the United Nations has called for every country to allocate 9 cents out of every dollar spent on health to mental health. Canada has been hovering around the 7 cent range for quite some time. So we've been underfunding mental health for many decades. But now with COVID-19, a situation like this, I think, really exacerbates the tensions. As you pointed out, people are losing jobs. They're having money problems. There are health concerns. There's anxiety and worries about our parents. There's isolation. These are all classic stressors that I think you don't have to be a psychologist to know that will increase mental health challenges. And so one thing that I know the government has done is they've created a hotline, a phone number that people can call, and they can go to my website at dondavies.ca and find that. And so that's a step in the right direction, but it's not enough. And so I'll be calling on the government. I have called on the government to use this crisis. They say never let a good crisis go to waste. I think that by exposing some of the problems in our healthcare system, we can use this as a great opportunity to see where the problems are, and we can address them going forward. So I've been calling for a significant addition of funds into mental health now and moving forward. And I think it was estimated about 1.5 million Canadians need mental health services and are not getting it now. So COVID will only increase those numbers. So I'm concerned about lack of access to one-on-one counseling. We're hearing reports that things like domestic violence numbers are going up. So it's not just an individual problem, it's affecting family units as well as people get tense. I think, we're all joking that we're getting on each other's nerves a bit, staying at home sometimes, but that can become a serious problem. And then of course you have the people who are isolated, the seniors who are by themselves, who can't get out, and family members aren't able to visit them as much as they can. So it's a serious problem, and I just want to highlight the spotlight on this, in addition to the physical health challenges that we're facing. And let's come out of this very quickly with a renewed, I think, commitment to our public healthcare system. I don't know if you want to talk about pharmacare, but I've been pushing for an expansion of our public healthcare system for years now. And I think Canadians, through COVID-19, now they realize how important our public healthcare system is, how important our public healthcare workers are. So the opportunity to say, look, once we get COVID-19 under control, let's make sure every Canadian gets the medicine they need. Let's make sure Canadians get the dental care that they need, the mental health services, the eye care, the auditory. Let's expand our healthcare system, which was Tommy Douglas's dream 50 years ago. So I'm excited about the possibilities moving forward if we're strong enough and smart enough to grab the opportunity.
Okay, more than 8 million laid off Canadians have already applied for $2,000 a month Canada Emergency Relief Benefit. Many automatically lost their workplace medical coverage, which you were mentioning, and the day their job ended, while others will lose their benefits a month after being laid off. You said that every Canadian deserves the medicine they need without regard to the size of their bank account. If COVID-19 has taught us anything, it is important for our healthcare system, the public healthcare system, and the need to cover everyone, not just the lucky ones to have that has a job with health benefits. That is
right. Well,
your
that's right. Well, thank you for asking. Great research as always, Luisa. Well, Canadians are very familiar with the benefits of a public healthcare system where we have universal access to our doctors and our hospitals. Doesn't matter how much money you have. Mm-hmm. Doesn't matter what your employment status is. If you need care, you get it paid for by our public tax dollars. Canadians are seeing with COVID-19 how unreliable employment-based benefits are when it comes to pharmacare or dental care. If you lose your job, you lose your benefits. And so I think this is we've known this for a long time, but now we have millions of Canadians who are actually experiencing it. So again, I think it's time to expand our public healthcare system to include prescriptions and dental care. We talked earlier about mental health. Well, I always joke, we cover your whole body, but we cover you from the tonsils back, but not the tonsils forward. Uh-huh. So we got a great system. It just doesn't cover your brain, your mouth, your ears, or your eyes, or your in some cases other things. So I think it's time for us to close some of those gaps. And we've done the work on pharmacare, and I think if you go to a doctor and you get a prescription, you should be able to go to the pharmacy, hand in your prescription, and the medicine is provided to you, and that should be paid for by our public system. Just like it is in hospitals, by the way. If you go to a hospital and need a prescription, it's provided that way. So this was part of the original dream of Tommy Douglas, to start with physician care and hospital care, and then expand it to medicine, expand it to dental care. But for 50 years, we've frozen. And so, again, the present circumstances, I think, give us a really good idea of what it looks like and feels like when your job doesn't provide you with those benefits. 7.5 million Canadians, 20% of Canadians don't have prescription medication coverage now. Now a lot more people are knowing how it feels to be in that position. So let's fix this. It only costs $10 billion a year. We've spent $130 billion in the last month. Right? So $10 billion per year to make sure every Canadian gets medicine they want, to me, is a wise investment. And by the way, do you know what? We've actually done the calculations. Believe it or not, if we cover every Canadian through our public system for pharmacare, we will over time end up saving money, because you save money from bulk buying, you save money from the people that don't get sicker and end up costing us more down the road, streamlined administration. I'll stop here, but I'll tell you this, there are over 100,000 private pharmacare plans in this country. We can get rid of all those and have one per province. And so you think of the saved administration, the bulk buying, the keeping Canadians healthier, and you end up saving about $4 billion a year and covering every Canadian. So it's economically smart too.
We'll be back. Don't go away.
Small businesses are hit like the hardest during the pandemic. The temporary closure implemented by the government impacted many businesses. Some are permanently closed down, and it really breaks my heart. A lot of them, some of my friends, have closed down their stores, their restaurants, like for good. And they were really doing well, very, very well before this pandemic. I know that we don't have a lot of time to discuss the federal support available for small businesses affected by COVID-19 crisis. So what assurance can the government or can you give to the business owners who are in limbo right now? Like, for example, all those who still want to probably keep their business and not close down. Well, if the country is not to reopen soon.
Well, you've asked some great questions. I mean, in terms of when, I don't think anybody can really give you that answer. It's my speculation that I think we're over the hump, and I think probably by June you're going to start seeing some phased-in reopenings of certain kinds of businesses. Those businesses where we still can practice certain kinds of physical distancing and can reopen safely, I think you're going to start seeing those businesses phased in, and others will take longer. The assurances I can give you is I think I can speak for all parties in House of Commons that we recognize two things. We recognize that small business is truly the engine of the Canadian economy. They by far create the most jobs. And I mean, if you look at my riding of Vancouver-Kingsway, it's all small business. You know, the biggest employer I have is Purdy's Chocolate, but most of them, it's the nail salons, it's the hair salons, it's the restaurants, it's the small computer repair, it's the corner store. Those are the kind of businesses that are powering our economy. And so we recognize that. And the second thing we recognize is that we have to support our small business community. You know, I'm a New Democrat. We've been working hard to bring that voice to Parliament. And I think we've had a positive impact. Originally, the Liberal proposal was to subsidize wages up to 10%. We said it should be 75%. And to the Liberals' credit, they made that change. They also made the change. There's a $40,000 interest-free loan to small businesses. Originally, you had to have $50,000 of payroll, up to $1.5 million. We got them to expand that. So now it's only $20,000 of payroll per year. So that would have more small businesses able to apply for that $40,000. And if they pay it back by the end of 2021, they get $10,000 forgiven. So Is it enough? I don't know. I don't think it is. I depending how long this goes, I think we're going to have a second round of supports. If we're into July and August and there's still significant business closures, we're going to have to sit down with the small business community and find out what more supports they need. And I can tell you that I'll be one person, yelling loudly for whatever small business needs, because you're right. I've been talking to small businesses who say they may not be able to reopen.
Yeah.
And, we have to find a way that every business that was opening or that was operating before has an opportunity to reopen after, and I'll be doing everything I can to make that a reality.
Well, thank you, Don. I guess we have a small business too, besides, our music and touring, and we have small businesses up north. I don't know if Steve and I told you about that, and we're one of those business owners that are kind of like, okay.
Well, and what I'm worried about too is there's whole industries that are clearly going to take significantly longer to recover, like the tourism industry. I was talking, like, how long will it be before our hotels are as full as they were before? People won't be traveling for much longer than a while. So, and then there's all of the spin-off businesses that supply those. So there's a domino effect that goes right into our community, and I don't think we really understand the full impact yet. But I think the important thing, and the assurance again I can give, is we in Parliament know how important small business is, and there's not a single parliamentarian that doesn't want to do everything we can to help them. So we'll be agitating hard, and I encourage small business to call their MP. I'm getting to be in contact and let us know what your reality is. I talked to Amado Mercado just the other day, a very well-known person in the construction industry in the Filipino community, and he was telling me about some of the challenges that he has. And so the more that you can inform us of what the realities are, the more we can take that to Parliament and try to craft solutions that will actually help. But there's no question business is under real pressure right now, as well as people.
Oh, yes, we are. There were anti-lockdown protests in Vancouver. I'm sure you're so much aware of this, but many law-abiding people are outraged by this and criticize the rallies. BC Health Adrian Dix, who's your friend, your good friend, said in a news conference, focus on what we need to do together and don't allow people who are attempting to promote themselves by using the suffering of others to distract us. So don't promote them, don't look at them, but focus on what we need to do together. What do you say to the anti-COVID-19 lockdown protesters?
Well, first of all, those are very wise words from Health Minister Adrian Dix, and I think he and Provincial Health Officer Bonnie Henry are doing an outstanding job here in BC, and the numbers are showing that. What I would say to them is, look, we have to do two things. One is we have to be guided by science, and number two is we have to think of each other. And, this kind of pandemic requires us all to acquire what's called herd immunity. And we all have to make sure that we take steps not to infect our neighbors and our friends and our community. And if we all do our part, then we can make this pandemic disappear faster. And if we don't, by engaging this kind of irresponsible behavior that's anti-science, anti-fact, and it's anti-community, what they're doing is putting us all at risk. And you know what? It's the thing, it's not just everybody, it's our most vulnerable citizens who will be at risk, our seniors. And so if you don't do it for yourself, you do it for them. And I know it's challenging, the self-isolating is hard. And I think we have to do everything we can to try to get people back to normalcy and our economy running as soon as we can do it. But it has to be done safely. It would make it a real waste if after this amount of self-discipline and sacrifice that we rush it and then risk a second wave of infection. Because you know what, Luisa, it results in death. I mean, we're not fooling around here. I mean, we're talking about life and death. So the result of a hasty decision or irresponsible decision is making people unhealthy and perhaps even dying. And so I think we're more than halfway there. I think we're measuring reopening starting in weeks now, not months. There will be longer term measures that I think we'll have to respect for some time after that. But everybody's done very well. I'm really, really proud of our community and how well everybody has stuck together. Those kind of protests have been very small. I think it's a tiny minority of people who are thinking that way. Bigger south of the border. I think they have more problems in the United States than here. But Canadians have been, I think, very, very good about listening to public health advice. And if we stick together, what do they say? If we don't hang together, we'll hang separately.
That's right. And, you talked about outside the border. Oh, that's nauseating. It just makes me sad and sadder and sadder every day. As a matter of fact, after our interview, I'm interviewing a good friend of mine who's a five-time Emmy award-winning makeup artist from New Jersey.
Geez, I could use them popping over to my house. I could use a little work. Do they cut hair? Do they cut hair?
You know what? It's nice to laugh a bit and smile, and and sometimes there was a time when I really get so annoyed with these people who are anti-lockdown, anti-social distancing, anti-everything, and I just don't get it. I really just don't get it. Because while you and I and the rest of Canada are advocating we are actually doing really well. But, one life is so important. Even lose one life a day, we're so sad. I mean, how much more with thousands of people dying every day, just like what's happening in New York. It's so sad. But okay, but it is what it is, and this is what you and I have to do. Just keep on advocating for people, because we've done so good. We don't want to break the cycle of awesomeness for Canada, right? But we just want to pray for Quebec that they just get it. They just have to get it, and just stay home and just don't infect other people.
Well, thank you for that message, Luisa. That's one I think we have to repeat and repeat over and over again. So thanks for your leadership on that.
Don, you have been an advocate for a lot of things. I know that. We've been friends for a long time. We know that you have been working hard, for the benefit of Canadian people and the health care system, where your heart is so close to the healthcare system. On April 1st, you played the violin. So I was disappointed. I was so disappointed that there was no video of this performance. So, you know what I was doing? I looked around and searched and surfed, like, where is Don, playing the violin on April 1st? There was nothing. It's just your picture, your post, which is great. But, right now, maybe request your honorable performance.
You know what?
The show,
for you, Luisa,
to thank, because I'm going to send this to all my health worker friends and all my friends who are out there, risking their lives every day, just to continue on working for our benefit. So can you just play even just a little, or you can even play the whole thing? I mean, I don't care. We can do like a 2-part series of this interview.
Well, Luisa, listen, even though me playing the violin is almost certainly going to cost me votes, you know what? I'll do it for you, because you know what? You are a performer of just international quality and fame, and I'm just an amateur, but for you, I will play my violin a little bit, even though, like I said, I know I'm going to lose votes. So,
do you have your violin there?
I do,
okay.
But I'm going to, okay, here's
just
one.
A bit. You don't need to do the whole thing.
I'll just play you a tiny bit, a few things here.
Oh, that brings tears to my eyes. Oh my goodness, Don.
Oh, well.
Oh, thank you so much for that
Oh.
beautiful piece.
Oh, it's just a small little bit, but I need to practice.
Thank you so much for this honor of you being back on my show. Thank you, thank you, thank you, thank you.
Luisa, thank you so much. It's an honor and a privilege to be on your show, and you stay well, to you and your family, and to all of your viewers. Stay well, everybody, and we'll get through this together.
Thank you, Don.
Thank you.
You're simply
Take
the
care.
best. You're simply the best. Thank you.
You're the best.
Bye-bye, Don.
Thank you, Luisa. Bye-bye now.
Welcome to Relive the Music, a brand new one-of-a-kind show that takes the audience through music history, trivia, and memories of the 50s and 60s.
We're gonna rock around the clock tonight.
Let us not get infected and let us not infect others. Please follow us on Facebook and Instagram. Hope you enjoy the show. Thanks for watching. Please don't drink and drive. Don't text and drive. Always be kind. Let's stop bullies and the coronavirus. Wash your hands. Stay home. Stay safe. See you next week. Bye-bye.